Hey guys, this is Dr. Mahajan from Mahajan Medical Center. Very excited to bring our live webcast back after a couple of weeks of break. I hope you guys had a fantastic Thanksgiving. We at Mahajan family had a good Thanksgiving with our son visiting us from Connecticut, so that was a treat. And we took a break and spent some time in the hills of Tennessee, and that was very refreshing to get a break from your daily routine and spend time with the family. Hopefully, you folks had a great Thanksgiving as well. We have a wonderful guest today. He's a physical therapist, he's a doctor of physical therapist, Jacob, and we're going to get him on our webcast in a minute. We are also going to talk about COVID vaccines since they are the flavor of the month right now. So that's another thing we're going to bring up today. And we're going to end with, as we normally end with, breathing exercises. So do give us a like and love. And so we know that you guys are watching our show. If you are tuned in, or if you're going to come later after work and watch it on YouTube or Facebook, but not live, then we still looking for your love and your recognition that you are watching our show. So without further ado, let's get Jacob on our podcast today. Here we go. Hello, Jacob. Thank you for coming to our studios to join me for another wonderful edition for our patients to learn from all the thought leaders. And you are a thought leader with physical therapy. So welcome.
Thank you so much. I appreciate it. I really appreciate the opportunity to come and talk to you, talk to your audience. I always love our conversations. So it'll be nice to have another one and to be able to share it with a few people.
Great. So let's talk about you a little bit. How long you been in Florida, Jacob?
Let's see, long enough to have thin skin to this cold weather out there. So I moved down here in 2009. Been in the South my whole life, in North Carolina and in Georgia. Moved down here, and that's when I started practicing, actually. So been practicing, and that's 11, 12 years now at this point.
Oh, great. So walk us through. I know there are different levels of therapists. In state of Florida, you need to be doctor now, correct?
Yeah, all of the programs, the credentialing programs at this point are doctoral level programs. But there are individuals who were grandfathered in to their license through bachelor's programs or master's programs in the past. I don't know that I can tell you the exact time frame, but it's been a few years now that I think all of the schools are putting new doctoral physical therapy practitioners out there. So at this point, that's the standard of the education.
Okay, that's good to know. So so that means you guys have a lot of hands-on experience, a lot of didactics before you get to touch the patient on your own, correct?
That's right. Yeah, it's a 3-year postgraduate program. And a lot of focus on differential diagnosis and a lot of practical experience to try to help people of all types and flavors.
Okay, great. So let's just put up your banner about your name of your company. So you're one of the optimal performance physical therapy clinics. I know there are lots of them throughout Tampa Bay. You want to talk about the structure, how optimal physical therapy is run?
Yeah, so we are a physical therapist-owned practice. So all of the clinics in the area, and it's almost entirely in the Tampa Bay area. There is one in South Florida, but largely we're in the Tampa Bay area and sort of surrounding areas as things expand a little bit. But each one is owned and operated by physical therapists. So what we do and how we do it is guided by those of us who are actually, on the floor treating patients and understanding what it takes to treat and help people. but also to run a business, run a clinic. But the group has been around since 2010, I believe, and it has slowly expanded as our network of physicians, like yourself, who grace us with the presence of their patients and trust us with the care of their patients. The name grows, and the expanse to which we can treat has grown over the years.
So let's take your office, the one in Bryan Dairy. So how many physical therapists are there at a given time? Do you have aides? How does the office structure set up?
Yeah, the location on Bryan Dairy, the sort of Largo, Seminole, Pinellas Park, Mid Pinellas. We have a bunch of names depending on how you want to describe our area. Ardmore. That location has 5 PTs that are there. All PTs, doctor or physical therapist in the clinic, no aides or techs. So we have this sort of direct treatment approach with a PT and a patient. And that's been really good for us. I think it enables us to really get to know people that we're working with, as opposed to in some cases where patients are moved from one therapist or assistant or aide to another. So developing that relationship with people has been really helpful in terms of helping people with their treatments, but also getting to know them and enjoying the process a little bit more.
Some of the competition, like the big chains or the hospitals, what I learned, and correct me if I'm wrong, they have one doctor, physical therapy, and then they have aides and techs working under them. Is that correct? And your clinic, as you said, has the therapist directly working with the patient, correct?
Yeah, that is an approach that some places will take, to have the therapist, the licensed PT, do the initial assessment, and then the treatments are often followed up by other providers of various sorts and various trainings. So we really like to keep the same patient with the same PT. The need for reassessment, reevaluation of each individual patient on a fairly regular basis is necessary to guide their plan of care. So we really feel like that's the best approach that we can take with each individual, is to have that treating, evaluating therapist be also the treating therapist and the reevaluating therapist, as the case may need.
Yeah, that's great. So that gives the continuity, from one session to next session, so there's no handoff and things don't get missed in the handoff. So that's great that you can do that. So I appreciate that. Let's talk about let's say in a typical day. I know a typical day could be different every day, but what are the top 10 things people normally come to your clinic for therapy for? What are the top 10 conditions, you would say?
Yeah, it's a good question. And actually, it's, one of the things that I'm, looking forward to kind of sharing with you all is that it's a pretty wide variety. I mean, there are some common issues, spinal issues, really. That's the bulk of most people's problems, whether it's neck or lower back or mid and upper back. That really, has a high percentage. But a lot of shoulder issues and knee issues and hip issues and ankle issues. So, if you think of all the major joints in the body, elbows and wrists, we see a fair share of everything. But if I had to boil it down to one thing that's most prevalent, it's the spine. It's the center of the body, and I think there's good reason for that. We use it for a lot of stuff, and it comes under fire quite a bit with our regular day-to-day activities. But in our office, we treat everything from vestibular or dizzy patients to, we have a pelvic floor physical therapist in many of our locations who deals with issues that are specific to the pelvic floor dysfunction, whether it's an incontinence issue or a pain issue or other elements as well. We treat jaw pain, headaches, and a number of other things that kind of come up along the spectrum.
Now, with the COVID and a lot of people working from home with remote working, Are you seeing more effect of the posture of people coming in with the neck or lower back? Have you seen any increase or any different in with the COVID?
Yeah, I don't know that it's directly related to their remote work, but it's been a change for everybody. So whether they have changed the ergonomics, maybe they were set up really well properly at their office, but at home they don't have very good ergonomics. Maybe they don't have the right desk or the right computer or what have you, or whether it's them changing their workouts. Maybe they were going to a gym or seeing a trainer or having some specific workout routine prior to COVID. And then with COVID, they have began to run more or lift weights at home or do other kinds of activities that they weren't accustomed to. Most of the injuries that we see in the clinic come when somebody changes their activity, does something new that they just weren't really ready for. And that could be an exercise, or it could be something like, painting a few rooms in your house when you put a lot of stress on your elbow when it's not used to it, or something similar.
The county we live in, Jacob, is geriatric county. A lot of senior folks. Have you noticed that changes the kind of diseases or the conditions you have to deal with?
Different populations are going to come with different issues. There's certainly, anytime you're dealing with a geriatric population, there's going to be more chronic issues and illnesses and degenerative and chronic conditions of the musculoskeletal system from wear and tear, from usage or mileage, as I call it. The likelihood that you're going to develop wear and tear on the body over many years compared to just a few years is significant. So we see a variety of ages in the clinic, but there are going to be some different things that we're seeing in the elderly population versus what we're seeing in the younger and more active population, for sure.
Well, I am a big believer in lifestyle changes for any diseases, and I consider mobility, exercise, an important part of that regimen. And I think a lot of time physicians don't think of physical therapy, occupational therapy as an important tool to help with the patient recovery. But it must be very satisfying, once the patient come in crippled with the pain in their shoulder or spine, and then, a few sessions later, they're able to move better and they have better quality of life. It must be a very satisfying field to be in.
Absolutely. Yeah, I would agree with you. I know from our experience together that I'm preaching to the choir a little bit, but I agree that everyone should think about mobility or lack thereof as being a problem that they should have addressed. And it helps to have somebody who is specialized in enabling movement. When people come in and they are having trouble moving or having trouble living their lives to the extent that they want to live their lives, that's where we try to come in and help. And when they can get to those goals, whether they are high-level goals like participating in some sort of high-level sports, or whether they are more simplistic daily goals like being able to stand up from a chair or get into their own bed or up their own stairs or something similar. Brushing their hair when you have a shoulder injury and you haven't been able to get past here, and all of a sudden you can get up here, that's a win for the day for a lot of folks. And so it's nice to see those moments. And when somebody comes in for a session and they say, look what I can do now, isn't this cool? That certainly makes my day. It motivates me to try to do as good a job as I can so that people come in with more of those days and more of those statements than the alternative, which is, I don't feel so great.
No, that's good. And, I think physical therapy is a very critical tool in chronic musculoskeletal condition before we start pushing for surgeries. For example, in knee or hip arthritis, If you have muscles which are not conditioned and you set them up for brand new knees or brand new hips, that's not going to improve their quality of life unless the muscles are ready to take those knees and hips. So a lot of people, they come to me, they want surgical clearance for knees and hips. And I said, how's your motility? Or doc, I can't walk because of the pain or arthritis. And that's a catch-22. So, I tell them that even then, try doing some therapy, whatever joints they're going to get replaced first. So that way, when they get the joint, they can take advantage of it. Otherwise, they will be not any better off post-hip or post-knee replacements.
Yeah, for sure. It's something that we talk about when those individuals come in, that, this is really a win-win situation. Either we can correct the problem to the extent that you maybe even don't need surgery. Sometimes that's possible. Or we can set you up so that surgery is more effective and the post-operative rehabilitation is even easier. So we call that prehab. So instead of rehab, the pre-op, rehabilitation. And so that benefits people, like you're saying, if they may not be able to tolerate that surgery or the post-operative rehab if they aren't at a certain level of strength or certain level of mobility prior to it. So it really helps quite a bit to enable better outcomes with surgery if surgery is the necessary component.
Yeah, that's a great point. Let's see what else we got up here for our discussion. So we have, what is physical therapy? What is that we do? What are the benefit of therapy? So you want to take one at a time. What is physical therapy, Jacob?
Well, I guess I wanted to give people a chance to understand a little bit more about what PT is, what it does, what it can do. Because I know that that's one of the things that, I hear a lot, whether it's patients who are coming in and they're a little skeptical of, what they're doing and why they're here and what I can help them with, or whether it's even, as I discuss it with friends, family, and other folks out and about, that they sort of know the term, but they don't necessarily know that much about it. So I kind of came up with a series of, just to help to describe the answers to those questions, I came up with with 5 different, I call them myths, but I'm not even sure that's the right term for it, just misconceptions or sort of thought processes that people have about physical therapy that maybe would help to answer some of those questions that you just put up there. So maybe we can kind of talk through a few of those myths.
I put some myths up there. So the first one is going to hurt. So let's talk about that myth.
Well, that's a common story. It's possible that you hear that when you're recommending PT and that people are wary of, it's going to hurt. I hear quite a bit where people are wary of that. First things first, PT is physical therapist, not pain and torture. It's not a physical torturer or physical tormentor or physical terrorist. We have lots of names that we hear on a pretty regular basis, mostly, I believe, in jest. I think so. But, our goal is to help people move better. It's not to inflict or cause pain. Pain is a byproduct of some of the treatments that we go through. That is certainly true. But what you want to understand as an individual potentially coming into physical therapy is that you want to have a better understanding of when that pain is what we would call a productive pain, when it's something that actually is helping you achieve a goal, or whether it's something that's actually hurting and making a situation worse. So we want to help define and differentiate those things. So, the idea that, I don't want to do PT because it's going to hurt. The truth is, the vast majority of our treatments are purposefully non-painful. We want to eliminate or reduce pain rather than increase it, as you might expect. The thought that it's really painful to go through PT is applicable to some diagnoses, but the vast majority really isn't. So it's one of those things that I kind of like to dispel. That's not the goal. That's not the intention. The intention is to help you move better.
No pain, no gain.
Yeah, it kind of goes into what I was just describing. But I don't know where the origin of that phrase really comes from, but I believe that, in my opinion, no pain, no gain is really a reflection of a healthy and fit body. When tissues work well, then we push them to their limits in exercise to make them stronger and better. And that makes sense. So if you are a marathon runner and you're trying to increase your speed, you got to kind of push till essentially it hurts a little bit to get better. Weightlifting and things like that can fall in that same category. But when it comes to rehabilitation, pain is not something that we shoot for. We don't strive for that. So when some folks will come into the clinic saying, I have this knee issue and it's really bothering me. And then I had to climb up on the roof to clean off some debris the other day, and I had to do this and that, and it really hurt, but it's okay, no pain, no gain. We try to dispel that idea and say, look, productive pain, as I mentioned a little earlier, productive pain is good when it's getting us somewhere. That's an acceptable idea. But largely, if it's aggravating, inflaming, irritating the stuff that you've already damaged, you're probably making it worse, or at least not helping it get better. So we try to say, let's stay away from that phrase, no pain, no gain, but let's have the therapist that you're working with try to help you understand the difference between what you're feeling. Are you feeling what we would call sort of a good pain or discomfort, meaning, oh, my muscles are a little sore from working out, versus an increased inflammation in a joint or a part of the body that's damaged?
Right. So the third myth we're going to tackle is that physical therapy is just about ice, heat, and tense. Is there more to it, Jacob?
There's more to it. These are things that I hear on a regular basis where someone says, oh, I've had physical therapy in the past. We did heat, we did ice, we did some electrical stimulation. And not that any of those things are wrong or inappropriate. They can be used properly in a number of different conditions, but there's a lot more to it. I would say the number one thing that we do in the clinic is actually education, helping you understand what it is that you're doing, what you're not doing, what you could be doing better, how you are moving, and where the problem really comes from. And when people understand that, guess what? They can fix themselves. That's the goal. So we try our best to educate on what's happening and why it's happening and how we might make it better. We use exercise, whether that's stretching or strengthening or stability and balance retraining, working on different parts of the body through exercise to make them better and more efficient with their movement. We use a lot of manual therapy, which means hands-on work. So that could be things like working through tight muscles or other soft tissues, or helping to mobilize joints in the body so that they move better. So there's a lot of different techniques that we'll use in addition to, say, things like ultrasound or ice or heat or electrical stimulation that we find are more effective. They're more effective in the literature. They're more effective in terms of what we do in the clinic.
Great. And then number 4 myth is there's nothing that can be done for me. You hear it often?
Hear that a lot too. People will come in with this, I'm not actually sure why I'm here sort of statement. And they'll say something to the effect of, this is, one that I hear a lot is, well, my knee is bone on bone. You can't fix that. And the answer is, you're right. I'm not going to try to fix your knee. I'm not a surgeon. I can't cure Parkinson's or lupus or something along those lines. Not a magician, not that kind of healer, right? But what we do is we help with movement. So all those conditions that I mentioned and many, many others, they create movement problems, movement deficits, mobility issues, and they decrease your function. So they make it so it's harder for you to stand, walk, sit, play with your kids, whatever it is. And our goal is to increase those efficiencies. Whatever you can do, you can probably learn to do it better. And so whether it's making the muscles around the knee stronger, so there's less of that bone on bone, or there's less pain associated with it, or increases the function that you have, or whether your balance can be improved so that you can feel safer and be less of a risk for having a fall and further problems. Those are the kinds of things that we want to look at. So when someone says, oh, there's nothing you can do to fix, fill in the blank problem, I say, well, true, we're not trying to repair the meniscus in your knee or the torn tendon in your rotator cuff, but what we can do potentially is increase the motion, the mobility, the fluidity with which you move.
That's great. And the last myth we're tackling today is, I have tried before and doesn't work. Have you heard that one too?
Yeah. Again, these are all from experience, from a lot of years of hearing people talk about it and trying to help them understand what it is that we can do. And I find when people are open to it, they respond well. So, the idea that people have gone through physical therapy before and it hasn't worked. The truth is that, as we discussed a little bit earlier, there are a wide variety of practitioners out there and different models for businesses where you might not get the continuous care of one therapist. That might have affected your ability to do it well. Or if you did go to a place where you got just that heat and cold and some stim and said, well, I didn't do anything, well, you may not have gotten the comprehensive treatment you needed. But even aside from that, I think that there's a wide difference in terms of how each individual responds to a particular provider. I know my guess is that with your patients in your practice, that you're probably not the first primary care doctor that they have all had, maybe a few of them, but they've probably had others, and they have moved around and they have found a Dr. Mahajan who treats them well and takes care of them and speaks to them in the way that they like to be spoken to. And that's why they like you and appreciate you. And same thing with a therapist. You might find one that you just don't really connect with. And in order for it to work, I think there has to be a really good relationship. So sometimes finding somebody who speaks your language, who sort of knows how to talk to you and knows how to get you to maybe be a little bit more motivated or kind of see it the right way. We talk about PT as being an evidence-based practice. That's what we try to strive. That's what we strive for in our clinic. There's a lot of science to it, but frankly, the science is the foundation, and the art is what we really do. So we take the science and we have to find ways to use it to paint it into the picture. And so I think sometimes trying a different approach, a different vision, a different strategy can be really helpful.
That's great, Jacob. We're going to have you demonstrate a few take-home exercises for our folks who are listening, and we're going to be keeping this webcast on our YouTube channel. So we're going to use your expertise, and we're going to label it so that way they can come back and also use it, though that does not replace having seen your physical therapy one-to-one, but at least they get general ideas. So we're going to get to that. Let me take a break from here. I'm going to talk about vaccinations, the COVID-19 vaccinations, and then we'll come back to you and have you demonstrate a few of the common conditions and what are simple things or simple exercises they can do. Sounds good?
Sounds perfect. Thank you.
Thank you, Jacob. All right, guys, we're going to chat a little bit today about the COVID-19 vaccine. I know that's a hot topic. We got Lily saying, good to see you. Dr. M, Lily, it's good to see you too. You've always been a very supportive of Mahajan Medical Center, so we appreciate that. So, as you know, the Pfizer vaccine, the mRNA vaccine, and the Moderna mRNA vaccine are almost at the cusp of getting out and about in the community. And the CDC and the advisory panel has said that the long-term resident and healthcare workers should get them first. So hopefully, next few weeks, we'll see the first rollout of most likely the Pfizer vaccine, and then followed by that, the Moderna vaccine, and then maybe somewhere thereabouts, the Oxford or the AstraZeneca vaccine will be right behind there. So we got 3 vaccines, which is very exciting. So a lot of folks has already started asking me when we're going to have in our clinic. So the answer to that question is we don't know yet, but it is coming. They're going to first roll it out to the most vulnerable population, which makes sense, to the nursing homes, residents, and the healthcare workers, which are getting exposed. So, the other question I get is about the safety of the vaccine and the efficacy of the vaccine. And these are difficult questions because the mRNA vaccines are new concepts. We never had mRNA vaccine, though it has been used in oncology. So it's not a novel concept, but for vaccination, it's a novel concept. So it's going to take time to see the answer to that question of safety. As far as efficacy go, again, different age groups, senior age group, pediatric age group, there is no definite answer to that because the pharmaceutical companies have given data on a diverse group. But I think once the rubber hit the road, and it gets used in diverse groups, different minorities, we'll see, if the efficacy claims of 90% plus still stands for the mRNA. But I feel comfortable with the science, what I've seen, to get the shot myself once it get offered to me. We need to move forward, and and you have to take the risk, unfortunately, when you're dealing with the pandemic. And hopefully it will turn out good, but again, it will be a test, which the answers will come as they get rolled out, and different minority groups and different age groups or throughout the globe gets it, and then we get data come in 6 months, a year from now, we'll have better understanding. But just the common sense is you can't hold still because it's causing already so much financial pain, psychological pain world over. Since March, it's been a difficult time for everyone, who's locked in their houses or nursing homes or assisted living. So you got to move forward. And there's a risk involved with the vaccines. Sure, there's a risk involved with every aspect of healthcare, and we do it. So we got to go with the optimism, and God willing, the vaccines will be one of the good tools. But my big worry is that we should not get complacent and say, okay, I got the jab, I'm not going to wear the mask unless we have the data, how long the efficacy is. I'll be reluctant to throw the mask away for at least 6 months to a year till we get some clarity in the efficacy. So that will be my 2 cents. A friend, Miss Felix, said, happy birthday. Thank you, Miss Felix McGill. That's very kind of you. Yes, it's my 21st birthday today. The flowers you see in the back is for my lovely wife. So thank you, Dr. Mira, for lovely roses. Let's get Jacob back, and he's going to show us some beautiful workouts for the common conditions, which you can implement in your day-to-day life. All right, let's get back to Jacob. You ready, Jacob? Okay, hold on. Let me get...
I'll talk through a couple of things, and we'll see what we can kind of learn together. First of all, let me second the happy birthday wishes. So appreciate you spending your birthday hanging out with me.
I didn't have anything better to do. I thought I'll hang out with you, Jake.
Well, that's good.
What do you have for us in mind?
So I wanted to just kind of talk briefly about some really basic things that I think are helpful for all of us to consider. Awareness of posture and balance and the way in which we move. Those are the things that I think everybody can start to do on their own. And then if you need help with it, coming to find a movement specialist like a physical therapist would be a good idea. But just being aware of where you are. Posture is one of those things that we always think about. Well, we don't always think about it. We talk about it a lot. People hear about it a lot. People say it a lot, but it's hard to focus on. When you're sitting or when you're standing, when you're doing really any activity, the type of posture you have does make a difference. And when I'm sitting in this chair and I'm sitting all the way back in the chair, I am allowing the chair to help support me and sitting upright pretty well. If I happen to move my body forward just an inch or two like this, and then I kind of use the support of the chair, all of a sudden I'm down a lot lower. You can't see all the side view of this, but you can kind of tell that from here to here is a difference in posture. And that's just really reflective of how I sat down in the chair. So knowing how you sit down, sitting all the way back in your chair, whether it's at work or in the couch at home when you're watching TV or in the car, utilizing the chair for its value is a nice tool to be more aware of how you're sitting or how you're standing. Once we stand up, then we can talk about where our balance is. So let's go ahead and stand up, and hopefully you can be able to see as much as you can. So when we're standing up, we're talking about the overall posture for how we are standing, where our weight is. So I can shift my weight back and forth, or side to side, I should say, a couple of times, and then I can actually do a forward and backward weight shift. And I'm just trying to get a feel for where I am. So this is one of the things that I like to have people do when they're dealing with balance issues, whether it's actually falling over kind of balance issues, or the balance issues where there just isn't a symmetry between the body that's causing, say, excess strain on your shoulder or your knee or your hip or whatever it may be. But figuring out where you stand, right? Instead of the weight being right in the middle, we can talk about it being over here on this side, over here on this side, or forward or backward. And that matters. So actually spending some time in the sitting position, thinking about where your posture is, and in the standing position and thinking about where your balance is, can be really helpful in just being more aware. So one of the things that we spend a lot of time working on in the clinic, when I told you before that we do a lot of education, it's about awareness and understanding what you're feeling. Most people haven't tried to flex or contract a particular muscle in their bodies that they can really isolate. So understanding what it feels like to use this muscle or that muscle or here, your core muscles, for instance, or the pelvic floor muscles with our pelvic floor physical therapists, or even some of the muscles in your neck that you don't think that much about how you use them, but you use them every day. So being more aware of your posture, practicing how do your shoulder blades move? So I can kind of turn this way and show you. Shoulder blades can move back here, or they can move forward, or they can move up, or they can move down. They can move in all kinds of different directions. And the more control that you can show, and the more control that you can be aware of, the better you're going to be at finding proper positions and postures. If my shoulders are a little too forward this way, then my arm doesn't really go up much higher than that. That's really it. But if I stand up, pull that shoulder back, now my shoulder's going pretty much straight overhead. Okay. So that's the same person. I didn't make that up. I wasn't, limiting myself. That's as far as my shoulder could go once I hunched over this way. So posture affects your back issues, your neck issues, your shoulder mobility, and assorted other things as well. So it's something simple like that can make a big difference. And you may need to have somebody help you through it and really show you the differences in what you're doing and what you're not doing. The idea that you can be more aware and help to correct some of this stuff yourself is really key. And the more that you start to understand how your own body communicates with itself, right? Everything's talking to the brain, but they're all kind of talking to each other. Your right leg and your left leg are talking. When I shift my weight back and forth like this, they're talking to each other, and one is loading and one is unloading, right? And so the better that they are communicating with each other, the less wear and tear there's going to be, the more efficient the machine becomes. So something simple, like one more thing I'll kind of walk through with you is standing up out of a chair. This is one of those things that I think people they don't think that much of it. But if you do it right or do it wrong, it makes a big difference. So when I am sitting in the chair, come down just a little bit, a lot of times what I'll see is people will take their hands and they'll put their hands on the armrests and they'll kind of push themselves up and come up to a standing position like that. When they do that, they're asking for more trouble with their shoulders, more trouble with their lower back, and more trouble with their knees. We can talk all you want about the biomechanics, but trust me when I say that you're putting more of that pressure on all those parts compared to if I do it the right way, which is to lean forward, to get a momentum shift forward and push myself up and forward. That allows me to use my muscles in my legs and my glutes a little bit better, and it takes the stress off of my back and off my arms. This is something better to be done in the care of a PT at first until you get the hang of it. But I really do try to get most of my patients to get out of the habit of using their hands to grab onto something or to pull themselves up or push themselves up. And more often than not, I get the statement, oh, I can't do that without using my hands. And usually within a session or two, they can actually stand up without the hands and show that they have more leg strength and more core strength and more mobility than they thought they did. So those are a couple of things that come to mind for me that sound very simplistic. Have better posture, be more aware of what you're doing, trust your balance and learn and understand your body and stand up with proper form. But that's just sort of a way to look at the beginnings of this, and we can kind of expand that to look at really high level movements like throwing a baseball or hitting a golf ball, or we can use it to assess these basic daily needs like standing up out of a chair or sitting back down in that same chair, or rolling from one side to the other in bed. There are good ways to do all these things, and when you have the help of a movement specialist like a physical therapist, you can achieve those goals.
That's great demonstration. In fact, I just moved my back towards the back end of the chair just while you're talking, and I see the difference. So, I typically sit all the way to the front and keep my spine straight. I don't lean back because I have enough core. But you're right, if you don't have enough core, then it's better to use the back of the chair and you don't think about it. But better than, sitting in the middle and then slumping over. So
you're exactly right. That's the issue that a lot of people have. If you have enough core stability, yeah, you can sit upright like you're talking about. What happens for a lot of people is they get tired, whether that's in 5 minutes or a couple of hours. So many of my patients that I work with, we'll talk about this, that I'm pretty sure either from assessing them in the clinic or from just talking to them that they sit down with really good posture. And then if you did the time-lapsed photography, 10 mintes later, it's here and then it's here and then it's here and then it's here. And 3 hours later, they're, hunched over their laptop, because they're working at a high pace. It's when you sit down, you tend to be a little bit better, but then you fade sometimes. But if you use the back of the chair to help you, give you some support, at least at times, to give you that sort of rest break, use it wisely, because otherwise you'll just kind of slump down into whatever's behind you. So that's kind of the idea. So I appreciate you recognizing that.
No, that's great. And the other tip you gave about leaning forward and using the momentum and using your thigh muscles, upper thigh muscles, to pull forward instead of using your hand is very good tip as well, Jacob, because, that's convenient to just push the hands of the chair. That's what they're there for.
Look, they're there to help you. And I don't think that you shouldn't use them at all. I want to kind of make that disclaimer. I just like to show people that they're stronger than they think. The analogy that I like to use, or maybe it's not even an analogy, just the example, is of going upstairs. I like holding on to the handrails, but I don't like pulling myself up with the handrails, right? The hold on to the handrails for the balance and the stability and the safety that you get, which is another good, that's okay to use the armrests here or something around here just to give you a little bit of stability. But what happens is it tends to go the other way, where instead of just using a tiny little bit of help with something for your hands and arms, you start putting a lot of pressure. You'll notice this with all kinds of folks who use canes and walkers, where instead of pushing the walker forward like they should, they lean down onto it. Shopping carts, they put a lot more and more and more pressure on it. And as soon as you start to put more pressure on it, then you start to develop that as your habit, and then it gets a little worse and a little worse and a little worse. We want to take it the other way. So we try to use the appropriate amount of hand support and stability and not overuse it. And that's the best way to phrase it.
As you said, the most common issue in the physical therapy clinics is spine, and posture is a big part to cause those spine issues. Let's give a bonus to our listening audience, Jacob. Give them, a simple core strengthening routine they can do to prevent any issues with the back if they're already decent, but if they're already suffering, maybe not the best time to do it. But once they gone through the acute phase, what they can do in 5 minutes, a couple of times a day. Give them a bonus tip as well. Again, folks, this is not a therapy clinic. It just general, guidance what Jacob is throwing. So if you need any specific help, we put Jacob's number there. And if you need a referral, you can call our office. They take all kinds of insurance, so we can facilitate that. But so give us a core muscle trick, which is on top drawer, what you have.
Yeah, like you stated, there are people who are suffering with back issues or neck issues. They're often in need of engaging and utilizing those core muscles in a better way. And there's two things that I would probably start with for everybody. And the first thing we kind of touched on just a little bit ago, this idea of awareness. Where are you? And what are you doing with that part of the body? So I like to do really simple movements. For instance, with a neck issue, I like to just take the patient through really basic active range of motion, side to side, turning the head side to side, or tilting it up and back. Now, this is barring that it's not painful. And really and truly, before we start any of these exercises, it's going to be beneficial to see your primary care doctor or a specialist, a movement specialist, or an orthopedic physician, or somebody who has a knowledge base in this area. But any sort of movement is key. So when we talk about all of these problems, movement is the key. So if you can continue to move your neck or your back, then you're in a good place. So finding pain-free movement is definitely important. Walking is oftentimes really, really helpful for lower back issues, particularly chronic lower back issues, because it allows for some movement. Whether you know it or not, your back is sort of twisting and turning a little bit as you walk. As far as core strengthening, I like to just get people to start thinking about how they engage their core, how they can tense up those muscles. And if you can't feel your muscles in your core, one little trick that you can do is just to take your hands out in front of you and push down, or I'll do it right here. So kind of pushing down on this table, right? I don't have to push down really hard. I'm just taking my hands out here and pushing down on the countertop here. And as I do that, you create a flexing of the muscles in the core. And so once you sort of start to feel where those muscles are, I think it behooves you to try to engage those muscles, to try to draw in the abdominals and get that contraction of the muscles and learn it. I don't like having people go through strengthening exercises until they know how to control the muscle and the area of the body. So rather than doing a whole bunch of more high level core exercises, the first thing you got to do is know how to engage and use the core. So if we don't know how to do that, we really aren't going to have success with the core exercises of other varieties, because we're probably not using them right, maybe creating compensations or doing other things that we shouldn't be doing. So we really have to start off with the foundation. And that goes for other parts of the body as well, for sure.
That's a great idea to have the awareness. We talk about awareness in the mental health as well, to be mindful. I think same thing applies to the physical aspects as well, to,
Absolutely.
be aware that what muscles are hurting, what muscles are in good health, what muscles need help, what muscles, are okay. So again, it's being physically aware and listening to your body. And that's very important before you jumpstart anything more advanced. So that's good tips, Jacob. All right, we'll put your clinic address here again. So for the folks who joined us late, this is Jacob. He's a doctor of physical therapy, and they have an office right here in Largo on Bryan Dairy Road. And
we also have if you go to the website, which I don't think is up there, which is theoppt.com. It's kind of a hard one to say, but the word the and then OPPT.com, and that way you can see a little bit more about the clinic, some photos, and the staff, and the different locations that we have around the Bay Area. But feel free to stop into any one of the clinics and say hi. You can take kind of a tour around and meet some of the therapists, and at any point if you'd like, and kind of feel free to call or stop by and talk about whatever's going on, and we can give you some thoughts about whether it's an appropriate thing for you if you think so.
Any final words of wisdom from physical therapy world, Jacob?
Keep moving. All right, keep moving. I hate to sound sort of boring, but if you don't move it, you lose it. It couldn't be truer. So continue to move. Try not to be afraid of movement. If movement hurts, let's come talk to somebody who knows what they're doing, because we want to get you moving as fast as possible. So do as much as you can, and then we'll help you with the rest.
Hi, Jacob. Thank you so much for coming to our webcast. It's going to help a lot of folks to understand what physical therapy is and how it can help them with their mobility or lack of mobility, or improve their posture, improve their strength in different parts of the body. So that was very kind of you to spend the time with us. And we're going to put your phone number and address up on our Facebook Live comments. So people who join late and they're not listening live, they can also contact you later. Thank you, Jacob, and have great holidays to you and your family.
You too. Thank you so much.
Bye-bye. Hi, folks. We're coming to the end of the webcast. We're going to spend a few minutes on alternate nostril breathing today, and we'll see if Jacob wants to join us in. Do you want to join us in alternate nostril breathing, or you have to go, Jacob? I think, okay, so we'll have Jacob join us in alternate nostril breathing. So it's a very good concept of breathing where, it can help you relax, and it can improve your anxiety level, or if you want to improve your stamina, it can help you there. But you have to practice regularly, like with physical therapy, like with any other new skill. You have to learn to do it every day. Even could be 5-10 minutes. It would make a big difference in your calmness and brings to you. And if you are getting into meditation, this is a good breathing exercise. It's also called Nadi Shodhana in yoga circle. So it's a concept is very simple. So what you do is you block your right nostril with your thumb, and you block your left nostril, not at the same time, but the concept is I'm just showing you which finger to use on which nostril. So with the right hand, the right nostril with your thumb, and then when you're breathing, with the other nostril, you block the left nostril with your index finger, and you keep the other two fingers on your gently on your forehead. So we'll do one cycle with you, Jacob. So you breathe in and breathe out gently, and keep not with the alternate, just breathe in, breathe out, just to get into the mode. So breathe in through your nose and breathe out through your nose. This time we want you to engage your core muscles, Jacob. So We're going to breathe in through the nose and make the belly button go forward, and then engage the core of the belly, and then breathe out or exhalation by pushing the belly button back. So let's do that. And you're breathing not through your mouth, but inhalation, exhalation is through the nose. So let's do that. Wonderful. So, that's again, to your point, knowing that not just the intercostal muscles are responsible for breathing. There is diaphragm and there is the abdominal muscles, and we ignore the diaphragm and abdominal muscles. So just to bring that awareness, that those are big muscles. We should engage them in breathing as well. All right, so now we will come to the alternate nostril breathing. So you put your thumb on your right nostril gently, and then breathe in through your left nostril, and then close the left nostril with this your index. With your ring finger, and breathe out through your right nostril, and then breathe in through your right nostril, and then close the right nostril. Open the left nostril, and then breathe out through your left nostril. Breathe in through your left nostril, close the left nostril, and then breathe out through your right nostril. Breathe through your right nostril, close the right nostril, breathe out through your left nostril. That's it. So the concept is any nostril you inhale, you close that nostril. So basically, it sounds complex, but it's very simple. Anytime you do inhalation in that nostril, it's time to close that nostril and you breathe out through the other nostril. And if you close your eyes when you're doing it and practice for 5 minutes, you should not get dizzy. If you're getting dizzy, then you're putting too much work. You should not put that much work. Then you should reduce the amount of breath going in and out. But as you get advanced, you should be able to do it for 10 minutes. And you will see that it will have beautiful calming effect on your mind if you go in a quiet room. Thank you for doing that with us, Jacob. And
thank you again. I appreciate it, and happy birthday.
Yeah, I appreciate that too. We come to the end of the podcast, folks, and we're going to have another podcast next Thursday. And we're going to have Dr. Juma, the oncologist. He's going to talk about different ways we can prevent cancers. And that's a big C, and no one wants to get that. And if we can avoid it, he's going to talk about how to prevent cancer so that we don't have to see a good-looking oncologist. And Dr. Juma is very well-respected oncologist with Florida Cancer Specialists. So it's going to be next Thursday at 4:30. Do tune in and be kind to yourself. Smile in front of the mirror. You're the best creation good Lord has made. Be kind to your family, friends, and the biosphere. Namaste. At Mahajan Medical Center, we care to listen to our patients. Proudly serve